Hello, hello, hello. This is Patrice Williams. I am so happy to be here today. We are doing a special segment of the Patrice Williams Show. We have our Solano County Chief Health Officer, and he's going to help me say his name correctly. That is Dr. Bela Matyas. Okay, he's going to tell me if I said his name right, but we are so excited to have him. As you know, Solano County is now in the purple tier, and we want to know more about what is the purple tier and how can we stay safe during COVID-19. And here we are going to bring in the good doctor of Solano County. Do I have you?
Yes, you do. Good morning.
Good morning. Good morning. Good morning. I'm going to turn up the volume to make sure everyone can hear you correctly. Okay. Give me the pronunciation of your last name.
Matyas.
Matyas.
Yep.
Got it. I only have to hear it 10 times. We are so happy to have you here. We're all notified Monday that Solano County has gone into the purple tier, and so the question is, what is the purple tier and how did we get here?
Well, if you recall, we were in the purple tier from the beginning of the blueprint up through September 21st, when our numbers were good enough that we were able to be put in the red tier. So the problem with the purple tier compared to the red tier is that there are a lot of limits on what business sectors can do and how they can operate. For example, now that we are in purple, retail establishments may only have 25% capacity as opposed to what had been 50% capacity. Restaurants are no longer permitted to have indoor dining. Fitness may not occur indoors, it can only occur outdoors. Essentially, indoor museums, movie theaters, family entertainment have to stop because they can only operate outdoors, and that's not really an option for them. In addition, houses of worship are not permitted to have indoor services. They can only have outdoor services. So there are a lot of our business sectors as well as our houses of worship that are adversely impacted by us going to purple. So this is harmful to a lot of the activities that we've become accustomed to over the last couple of months. And a lot of our businesses are not likely to survive this. We're likely to have more businesses go bankrupt and more people lose their jobs as a result of these restrictions. The reason we are here is because our disease rates are surging. Our disease rates are surging along with the rest of California and most of the US. But what's happened is that over the past month and a half, people have been increasingly getting together with family and friends and letting their guard down. It started off with a handful of large events, weddings, funerals, christenings, some gatherings that didn't make any sense to occur. And then we had large numbers of cases from those. But over the last month, it has basically drifted into virtually countless situations where people get together with one or several other families and they celebrate something. Halloween was a very big contributor to our disease rate. And because Halloween was such a big contributor, a lot of the cases have been relatively younger, which means that we're not seeing as many serious effects from the disease as we were in the summer when we were having a lot of this disease. As you recall, we had a really big peak in July as well. And that was accompanied by a lot of ICU cases, ventilation needed, people dying. And we're not seeing that at the moment. However, right around the corner is Thanksgiving, and then the December holidays, and then New Year's. And those are multi-generational parties or multi-generational celebrations. And so if people continue to do this, if they continue to get together with family and friends and not protect, then we will continue to see a surge. But unfortunately, we may see an accompanying increase in hospitalizations and deaths as well. So the simple answer to your question is we've done this to ourselves by getting together with family and friends, ignoring the advice, and not doing anything to prevent transmission of the virus.
So I know another question is, did our elections, is this spike in result of our election? And many of us voted in person. It seemed to be very carefully orchestrated, where the machines were being cleaned and everyone was required to. Is some of the spike because of November 3rd?
I would say no. We've seen no evidence of that. We've had no clusters that we can link to voting. There were a number of rallies, particularly in the northern part of the county in the weekend prior to the election. And then there were a lot of celebrations after the election results in that week following. So I can't say that none of these cases were exposed in those larger events, because those frequently did not have people wearing masks, and they certainly weren't socially distancing. So it's possible that there was transmission in those environments. The problem with that is, well, it's not a problem. The reality is people are denying having participated in those activities, in part because they don't want to be shamed for having done something like that. And so we're not able to learn from our cases whether they did or did not participate in those events. What we are able to learn is that our cases got together 2 weeks earlier, 3 weeks earlier with family and friends, party of 10, 20 people inside, nobody wearing masks, everybody sharing food. So those are very clear indications of how transmission is occurring. So the election per se, no. The events related to it, maybe, but people aren't letting us know that.
Do you see, based on your cases, are you seeing a breakdown in ethnic groups and ages? And could you tell us a little bit about that, if so?
Correct. So in terms of racial ethnic groups, Latinx, Hispanic members of our community are becoming infected at about 1.5 to twice the rate of whites. So they are more prone to acquiring illness, and we believe that that has a lot to do with the cultural elements of that community, and the fact that they have frequent get-togethers with family and with friends. The Blacks and African Americans and the Asian and Pacific Islanders are, as well as the people who describe themselves as multiracial, are all much more likely to be hospitalized than whites. And the multiracial and the Blacks and African Americans are much more likely to die than whites. So we do definitely see some trend of race ethnicity toward acquiring illness, and that would have to do with social behaviors or social norms. But then also because of underlying health issues, a higher likelihood of dying for non-whites. And that it's easy to say, oh, it's just because they're not taking care of their diabetes or they're obese or whatever. But I think you and I well know that those underlying health issues are the product of structural racism that goes back for generations. And so, unfortunately, we have created societal norms in which non-whites have more difficult access to healthcare and are generally not provided with the same opportunities to remain healthy. So it's not surprising when a disease like this comes along that it's going to adversely impact those groups to a greater extent.
How do we, knowing this and seeing the impact that the social norms, social behaviors, underlying conditions is having a disparity in the impacts of COVID-19, how do we look at this now and make an impact throughout Solano County and how we address healthcare and health systems?
Well, in the immediate, what we're working with the healthcare provider community to do is to specifically target individuals who have under-controlled, poorly controlled diabetes and hypertension, and bring them in for care and get them controlled. Because if they are stable with their diabetes and their hypertension, then they're not going to have an increased risk of a bad outcome. In addition, we are working with community partners like La Clinica and Catholic Charities to identify promotoras and other interveners with the various communities. And we're trying to reach out to the non-white communities, both to educate about how to protect themselves, but also to try to persuade them to realize, well, persuade is the wrong word, help them to understand that flu vaccine and COVID vaccine are safe, and that they are in fact going to help them to do better with both of these diseases. In addition, we are planning our vaccine distribution to preferentially reach those who are at higher risk of having serious outcomes. So as we are doing our flu vaccination, we're targeting high-risk groups. And then once we get COVID vaccine, we're similarly going to do that. So our hope is to be able to protect those who are most likely to have a bad outcome first.
I like that approach, but I think there is going to be a as a Black woman, I can tell you that the Black community, we get very nervous about vaccines and the safety, and we have our minds around what vaccines and where's this coming from, and are we being infected? With some, we're just very suspicious. That's the best way to say it.
Well, and that's a product of how we've lived our society for hundreds of years. And there's absolutely every reason to understand that. And I don't believe it's just Blacks and African Americans. I believe that that there may be similar concerns in some of the other racial ethnic groups as well. And what we have to do is find people that can deliver the message whom you trust. So that you shouldn't have to believe me as the health officer. Hopefully there are members of the community who are community leaders who are better able to answer your questions and help you understand why it's beneficial. The irony in that position is that by preferentially not vaccinating, Blacks and African Americans are actually increasing their chances of dying from COVID. And so if there were to be any type of nefarious underlying plot, it would be to get you not to vaccinate rather than to vaccinate. Now, obviously, the concern is, well, the vaccine's harmful. And I think one of the things that has to happen is we need to monitor the uptake of vaccine by all racial ethnic groups and see if, in fact, there is any differential harm, right? I mean, if whites are taking it up and Asians and Blacks and African Americans and Latinx and Hispanics, and everybody is having similar outcomes, similar benefits from it, then the argument that it's somehow preferentially harmful would not be valid. But again, the problem with that is that the data are going to come from people like me, and I might not be a reputable or credible source for that information. So I think one of our challenges is to find credible spokespeople for the topic who are trustworthy, who are honest, and who can represent the facts to the communities that need to hear them. And it's going to be different leaders and different spokespeople for different groups.
Well, I love that part of your plan is to connect with community groups and organizers to get various messages out. I think that's key. And there's times where I hear community officials say that, but I know that I'm part of multiple communities and intersections, and I never hear the word. So the fact that you're reaching out in that different type of way, I think is commendable. Can we back up a little bit and talk about how your department intersects with what do you do in Solano County, and are you part of Health and Social Human Services of Solano County? Are you part of that division or separated from?
Yes. So in Solano County, within government, we have the Department of Health and Social Services. And Health and Social Services contains many subcomponents. One of them is public health. So public health is part of Health and Social Services. And what we are responsible for is communicable disease control, like dealing with COVID and the pandemic. We run the public health laboratory for the county. We also provide services for maternal and child and adolescent health. So we run a number of programs to help those young families who are stressed in some way to be better parents and to make sure that they have what they need to help raise their children. So we run many, many programs in that general umbrella of maternal and child health. We also run the county's WIC program and nutrition services. In addition to that, we provide health education and community wellness programs. So we try to get messaging out there to help people understand what their risks are for bad outcomes and what they can do to try to reduce those risks. In addition, in our county, public health runs primary care and dental clinics. So we run 13 clinics across the county to provide dental health and primary care, pediatric and adult. And then we also oversee the Older and Disabled Adult Services program. So the IHSS program, the Adult Protective Services, Conservatorship, and Public Guardian, all of those programs are within Older and Disabled Adult Services. And that also oversees the Area Agency on Aging for Solano County. So public health covers a lot of territory. Right now, and probably for the past 8 months, I would say it's been pretty much all COVID all the time. And we've been struggling to keep up with all of the other programs, in part because the community has been rightfully concerned. And so, we've had to change how we interact with the community members we provide services to. And in part because we've had to redeploy huge numbers of people from throughout public health to dealing with COVID. And we've been getting, in this surge, we're up to about 100 cases per day. And so I need a team of about 30 people, excuse me. I need a team of about 30 people to keep monitoring that so that they stay on top of the case investigations and the contact tracing. And so if I need that many people, I only have 3 or 4 in the communicable disease program. It means I'm redeploying from other programs. But we do what we have to protect our community.
So can you tell us, what do we need to do to stay safe? How can we quickly get these numbers down at 100 per day? That is a large number. And then I'm going to ask you about, is there a breakdown by city, if you know that? But how do we're at 100 people per day. If we were going to get down to 5 people per day, would that take 14 days? Would that take 21 days? And what would we all need to do?
Well, how long it would take depends on our community. Keep in mind that what is happening right now is that individuals within the community all across our county are interacting with people in a way where they transmit the virus. So if you think about the fact that the virus is in our respiratory system and it has to go from me to you, if I prevent that from happening, we stop having new cases of disease. So when I am interacting with people, if I stay physically distant, if I wear a mask, if I make sure that I'm not out there while I'm sick, if I wash my hands frequently, then the chances of transmitting disease from me to you are remote. They decrease tremendously. And that's what we have to do all the time. Now, it's not that hard, as it turns out, to do that when we're shopping or out in public, because we're around strangers, and that reminds us that we need to be careful. Some people are also pretty good at doing it at work because it's just become a workplace habit. Where we really mess up, where we're really doing a horrible job, is when we're getting together with family and friends. Now, the governor likes to blame bars and restaurants, but in Solano County, bars and restaurants are not where the disease is spreading. We've had no clusters in bars and restaurants. What happens is people get together for a birthday party, or they got together for a graduation party or a Halloween party, or they get together because they haven't seen friends in a while. And they sit around the table, they sit around the room, they're talking, they're close to each other, they're animated, so they're speaking loudly, they're spitting. If somebody shows up who's positive, that whole room is now going to be infected. And that's what we see. We see parties of 10 or 20 people where half of them become sick. And so what that tells me is that sick people went, or this wouldn't have happened, and that there was nothing being done to prevent the transmission in that environment. So what we have to do is change how we interact with one another when we're with family and friends. Now, I'm not saying wear masks. That's not realistic. But what we can do is invite fewer people into an indoor environment, hug briefly and then back away. Don't kiss. Don't share food. Sit further apart when you're talking. Don't shout. On the surface, those are not difficult things to do. And you still get the benefit of interacting with family and friends. But we're not doing that. So to answer your question, we have to start doing that in our personal sphere, and then we can reduce the disease rates. How long it would take depends on how good we are at acting properly. Keep in mind, a month and a half ago, we were down to under 30 cases per day, and we were in the red, and we had very low positivity rates. So we were doing the right thing, and we have to go back to that stance. The problem is we're in holiday season, and now it's very difficult for people emotionally to remember to be careful around people that they are comfortable with. And it's ironic, if you were to ask the average person, what's more risky, going out to a store and interacting with strangers or getting together with family and friends, they'll all say it's the former, but it's definitely not the former. It's definitely the latter, because you don't typically go up to a stranger and smack them on the lips with your lips. I mean, you don't go up and kiss people and share food with strangers. It just doesn't happen. But you're doing that all the time with family and friends. And guess what? This is a respiratory disease. That's how it spreads. So it is actually very much family and friends that pose the greatest risk. Now, can you get together safely? Sure. We've seen that we can, because we did it for a couple of months. We just have to find a way to get back there. As for the breakdown by city, I can give you the actual numbers as of yesterday. In Vallejo, we have reported 2,930 cases. Fairfield, 2,862. In Vacaville, 1,798. Suisun City, 633. Dixon, 589. Benicia, 243. Rio Vista, 75. County unincorporated, 31. So what you see from that are that Sassoon, Dixon, Fairfield, and Vallejo have the highest rates per capita. They have high rates of transmission. Vacaville is about half as high. Don't really know why. It's hard to understand why, but it is. It's about half as high. And then Benicia, Rio Vista, and County Unincorporated are much, much lower. Now, some of that's understandable. County Unincorporated and Rio Vista are relatively rural, a lot of space between people normally, not a lot of shopping areas where you get together and interact. And a lot of those folks aren't, there's not community locations where you get together in large groups. It just, those are quieter communities. Benicia has been very, very active about wearing masks and has I think, done a really good job of intentionally trying to prevent transmission. Dixon and Vacaville are somewhat similar. Dixon's more rural, so I would expect Dixon's rate to be lower. But for the reasons that I don't understand, Vacaville's is actually quite a bit lower. And then the other ones are basically urban environments with lots of opportunity for people to get together. Again, we have not seen any evidence that the disease is spreading in stores, restaurants, fitness clubs, any of that. We have had a lot of outbreaks in church-related events, and we've been working with the church community to try to address that. But almost all of the rest has been in people's own homes. And the problem is the people who are getting sick, the younger people now that are getting sick, work in healthcare. So they're bringing the illness into nursing homes and into boarding care. And we have countless outbreaks in those environments because of the workers bringing the disease in. Or did they get it? They got it at home. So it's not just themselves and their family they're putting at risk. They're also putting at risk the clients that they interact with. And that's where the deaths have been occurring. Over the past month, the deaths from COVID have been occurring in these facility outbreaks, and they were caused by, workers bringing it in from home.
Wow.
Answer, sorry.
No, that's completely intriguing. And in fact, you even, I was going to note, and I think you addressed this, but I also have I'm considered an essential employee because I have a transitional home. So I go from, I live in Fairfield and I go to Vallejo and have picked up essential items from Vacaville and noticed just kind of the difference in the way each of these cities and people react to, wearing masks and consistency. And I'm surprised that the Vallejo, in a way, I'm surprised that the Vallejo numbers are so high because the Vallejo community, by and large, they just seem to be more on top of it. They were the first people to put up those signs on their businesses. They seem to comply. They seem to, there were gloves all in the parking lots where people were going to places with their gloves, and they seem to be on it. And then in Fairfield, I'll go to the gas station. I'm like, why are these people without their mask going inside the gas station without their mask? I don't know. It just seemed to be. And then in Vacaville, I'm like, why is everybody at the not at the outlets, but going to these different places in that, grocery store? I don't know. It just seems so culturally different based on what city.
But what you're describing is the fact that the public sphere, which is what you're observing, is not where disease is occurring.
Right.
That's, Vallejo, we're not getting cases occurring in the grocery store or where you see people wearing masks. Even in Vacaville, we're not seeing it where people aren't wearing masks and they're out at the stores. Stores are not spreading this disease. This disease is spreading in people's own homes. So the very same people in Vallejo who are careful when they go outside and they interact with others are not as careful when they're getting together with family and friends.
And that makes sense. And that also explains, I'm on social media not a lot. And I'm kind of aghast when I see people hugging and taking pictures together. And I'm like, how is that right? That's
right. And you see it on social media, Facebook, all these photographs of parties and groups and this and that. And honestly, that's how it's spreading. That's where we see the disease spreading, is when people are doing that kind of behavior. Now, I'm not going to say that that's bad behavior. That's normal human behavior. We're social animals. We need contact with one another. But what we have to do is be respectful of how to do that in a way that's safer, and especially for the elderly. I mean, honestly, the death rate and the hospitalization rate in young cases, young people, is much lower than in older people. You asked about age. The highest rates of disease and of death and hospitalization are in people over 85. Over 65 is bad. Once you get younger than that, our rates are quite low. For example, over the past month, we've doubled the number of children who are positive, and not a single one of them has been hospitalized. So children are more resilient. Young adults are more resilient. Elderly are not. And the problem is that, if you're interacting with friends and you're all young and you're doing that, okay, you might spread disease. You'll probably get sick. Hopefully not a bad course and won't need hospitalization. But if you then bring that home to your elderly, to your parents, your grandparents, that's when harm can follow. Or if you work with elderly people and you're not doing proper precautions in the workplace, that's when harm can follow. So it's not as simple as, oh, let the young people party because, they're not going to necessarily have a bad outcome. Those young people are part of the larger community, and there are many people in our community who do have bad outcomes.
So on the chat, a lot of the questions you've been answering you've been answering anyway, but here's one from Miss Alyssa McGuire. She's on Facebook, and she says that the farm workers in Dixon don't have the luxury of individual transportation to or from work to in Napa vineyards. And they're also in that community living situations. So she's saying that, there's workplace exposure. What are you seeing? Because you've mentioned it, you are one of your areas is that contact tracing. The contact tracers report up to you, so you're able to say, yes, we're seeing that community living. Is that something you're seeing? Community living and transportation in not individual transportation, but that group transportation scenario?
It's really important not to generalize the Hispanic Latinx community. Within it are many different communities.
Yes.
One of the communities is the farm labor community. And among them, there are those who are county residents with homes and families, and there are those who are transient, who are here only for the harvest. What we observed during the summer was that those who were here transiently were living 8 or 10 to a 1-bedroom apartment and then traveling together in a van to the vineyard. On the vineyard, they were working and they were pretty physically distant. So it was interesting that the vineyard was the safest aspect of their life. The van was terrible because they were all jumbled into a van, but they were also sleeping with each other sleeping together on the floor of a 1-bedroom apartment, 8 or 10 to an apartment. So, if you think about it, there was no way they weren't going to transmit among themselves. The household situation alone is impossible to protect in. The van adds to it, but I wouldn't blame the workplace. It was the living situation, because the workplace was actually the safest aspect of their particular situation. And we could have set up so that the van transport would have been safe, but we still couldn't do anything in the household. And so we had very high rates of illness among that group of farm laborers. We have not seen the same thing in Dixon, where many of the farm laborers are actually residents of the county with families, and they live here and they work in the industry. And we have had some clusters, but nothing like what we saw with the Napa vineyard workers. That situation was just different. So if you looked at it, though, if you teased it apart, the issue wasn't where they worked. The issue was how they lived.
How they live.
Yeah, we do definitely have workplace clusters. And one of the things we've identified is that we only find spread in the workplace when people are not socially distancing. So every workplace cluster we've identified was a situation where people were not wearing masks and not staying physically distant. We get a lot of cases who work, right? I mean, we've had over 9,000 cases reported. A huge portion of those are people in the workforce. And where they are in a workplace that has social distancing and they're wearing masks, we don't see clusters. We don't see spread. So it reinforces the power of social distancing as a way of protecting ourselves in the community, in the workplace, and potentially at home as well.
I'm going to ask you 2 more questions. The first question is, can you have COVID-19 and not know it, not have any symptoms, believe you feel just fine? Can you have COVID-19? And at what point do you go to get tested, and how?
So the answer is yes, you can have asymptomatic COVID. I mean, we see that happening all the time. In fact, a very high percentage of people who are COVID positive are asymptomatic. The question, which has not been answered, is are they able to transmit the disease? So this disease, like every disease, is dose dependent. The more of the germ you're exposed to, the bigger the chance of becoming sick. So if asymptomatic people are shedding very small amounts of the virus, then presumably they're not transmitting very effectively to other people. Now, that is not the same thing as to say that no asymptomatic person can spread. Of course they can. We know they can. We've seen situations where they can. But an average asymptomatic person is probably less good at spreading than an average symptomatic person. So the answer is yes, there are asymptomatic cases, and yes, they pose a risk to our community because there's so many of them. As for how you can get tested, if you're not symptomatic, really about the only place you can get tested easily are the state-funded county testing sites. And we have 3 of them as of today. We have one in Fairfield, one in Vacaville, and one in Vallejo. And you go online, you sign up, or you can call the number and get an appointment, and then they'll test you. And they're able to test among them several hundred people per day, and they get results turned around now in about on average 2 days. So if you're asymptomatic and you want to know your status, you can go to one of those sites and be tested. If you're symptomatic, you can go to your doctor and get tested. I mean, all healthcare systems are testing symptomatic people right now.
There's a question from Dr. Monique Hunt. Hi, Dr. Monique. How is COVID-19 impacting people long-term who are considered recovered?
There are many people of all ages who seem to have chronic residual symptoms after they've been infected. They don't recover completely, in some cases for months. And there are a lot of diseases that do this. COVID is not different. The difference is how much attention we're paying to it. The percentage of people with this type of situation is actually quite small, but the numbers are large because the COVID numbers are so large, right? We've had, 10 million cases in the US. So even if it's a very small risk, it's going to be a lot of people experiencing those outcomes. But yes, young people are reporting ongoing disabilities from having been infected that are lingering for weeks to months. And that is a reminder to us that it's not an automatic, you get sick, you get over, you're healthy and you're fine. That's not what this disease does. Neither does flu, neither does pertussis, neither do a lot of the diseases that we experience in our community. But because we're so focused on this disease right now, we're monitoring all of these things very carefully.
So you are, her second half of the question is about the long haul, those numbers being tracked.
Yes, they are. People who are in that situation are being monitored on an ongoing basis. They're longitudinally being followed to see how long it takes for their symptoms to resolve. And one of the things that's not clear yet is, are those ongoing symptoms because the organ was damaged and this is the product of a damaged organ, or is there some ongoing continual long-term infectious process? And part of the problem is we don't have treatments for COVID for the average case. We have treatments for people that are hospitalized. We only have 2 treatments available, well, 3, including dexamethasone. But unless you're hospitalized, you're not apt to be treated. So a lot of these are individuals who get sick, who have fever, who get through it, but then have these residual symptoms. And it's possible that they're having an ongoing infectious process, with the virus still present, or that their organ systems have been impacted. In a lot of people's cases, we actually think that the most likely situation is that their immune system, by fighting COVID, has been activated and it's continuing to fight even though COVID's not there. So it's continuing to cause symptoms even in the absence of the COVID. So all 3 of those are possibilities, and I would imagine that some cases are explained by one or another of all 3.
Awesome. So are there any final remarks or thoughts that you want to leave us with?
The one thing I want to note is this sad irony that our personal decisions causing us to become ill are being the people being punished, on whom it's being taken out are the businesses, which have nothing to do with it. So we are punishing the business sectors that are not responsible for the transmission because of how the state's blueprint has been set up. So when we are doing this, we are harming ourselves. We're harming the people we're interacting with. We're potentially harming family. We're potentially harming coworkers, and we're also harming our community. So, how many things have to be problems from our behavior before we take responsibility for our behavior? So at the end of the day, we have to be responsible for what we do. And it's the fact that we're not being adequately responsible that's causing this problem, and it's causing a lot of problems.
Well, I tell you, I appreciate you. Thank you for taking all of our calls from the chat. There's going to be people that are watching this broadcast afterwards. We usually get up to 1,000 viewers. And should we say that they should go to the SolanoCounty.com website, and then would they look under public health to get all of this information?
You go under public health. There's actually on the front page of the department a button to take you to COVID. So there's all kinds of information on there for the general public, for the business community, for the healthcare community. There's information on how to get tested. There's phone numbers to call if you have questions. We have a COVID warm line that operates during the workday for people who have questions. So that's the single best place to go to, and then from there you can go to where you need to.
That sounds great. Well, I tell you, I appreciate you coming on in such quick notice. I think within 24 hours, your team said, let's do this. You agreed to come on, and I really appreciate it. We have Gail Vaughn from Benicia. She is saying, thank you so much. And thank
you very much, Gabe.
So you got just a lot of people on the chat that's watching, and that's thanking you for talking about personal responsibility. Thank you so much.
Thank you very much. Take care.
We'll be in communication.
All righty. Bye-bye.
Bye now. So everyone, please hold on. We have, and we thank the good doctor for coming on. Hopefully that was helpful. I know it was helpful and meaningful for me. We're going to bring on Sonia. She is coming in from KALW to do a special information about KALW. Let's see if we can bring Sonia on. Sonia,
Hello.
you there?
Hello, good morning. How are you?
Good morning. Good morning. I saw you there in the waiting room. I was happy to see you.
Well, it's great to see you. And this was a very educational session. And I'm glad that you had Dr. Matyas on. I mean, I learned so much, and it's a topic that I've been researching quite a bit as a radio journalist. So I just found him so enlightening. Thank you for hosting him.
Oh, the pleasure is mine, and the fact that he connected with us so fast really, to me, shows that he is really committed to connected to the community in multiple ways.
Right. And I'm sure because the surge in COVID numbers is impacting all of us across the country, that, I mean, I think it's so important for him to be front and center on your live stream and talk to the people face to face, online, but through social media, to explain things that people can do, especially leading up into the holidays, because it is a big question mark for a lot of people. How do you celebrate Thanksgiving with friends and family when the rate of infection is going up in California and in the Bay Area? So I just think it's such valuable information to share.
It is. And, it was wonderful talking to you a few days ago. And you were telling me that there at KALW that you all care about health equity and health outcomes in Solano County. So when we were able to confirm the doctor, I immediately was like, we got to contact Sonia.
That's great. Yeah. So I want to tell you a little bit about KALW. And we are a radio station in San Francisco, but we cover all 9 Bay Area counties, including Solano County. So I'm really glad to be able to connect with you, Patrice, because, your audience is asking such great questions. I mean, I saw these questions coming up, and many of them were on my mind as well. So, I want to make sure that people in Solano County, across all the cities, have an opportunity to ask our radio station, KALW, what is on their mind, especially when it comes to health and inequity. And I've been focusing on election issues leading up to the November 3rd election. And now that is behind us, we're looking at launching a big project on health inequity. And we want to hear from Solano County residents, what is on your mind? What are the issues that are most important to you? What are the concerns that you've been having? And what do you want to see journalists cover on the radio, online, in live events? I'm leading a team of journalists that's going to be reporting on health issues starting in the new year. And we want to make sure that we cover the issues that are important to you and your audience, Patrice. So that's what I'm here to announce, is our effort to reach out and listen to your community. And KL, I'm not sure if I can share my screen. Otherwise, I can show, I can tell you the link for our website.
If you put the link in the chat, because I don't think you have the ability to. I don't think I can share. Oh, mm-hmm.
Okay, no problem. So I'll just drop it in this chat here.
Okay.
And then you can share it. So our website radio is fairly easy. And do you see that in the chat?
I see that, and I'm going to do two things. I'm going to put it in the chat for our community, and then I'm going to open it in a window and share my screen so you can walk us through.
Okay, and then I also want to share our form for questions from the community, and people can just type in their questions in this form. And right now it's on our election page, but we will be putting this form up on other pages. And, even though the election is over, we want to hear what your concerns are about how some of the election results are going to play out in your community, and especially how that relates to the pandemic. I know that there have been so many issues come up about increasing rents and access to healthcare and access to healthy food, and that ties in very closely with the pandemic because a lot of people have lost their jobs, unemployment rates have gone up. Unemployment benefits are ending in December for a lot of Californians, and that's going to be even harder as the pandemic continues. So, this is a place, this form, thank you for sharing, Patrice, is a place where you can type in the issues that you're most concerned about. And we want to hear what questions and concerns that we should investigate in detail. So, when we hear questions from you, that's our website, we can then assign these questions and concerns to our team of radio journalists and investigate, call officials like Dr. Matyas and others and find out, well, what are the problem? These are some of the stories we've done in the past. Our front page story is about COVID-19 testing. You may have noticed that lines to get tests are growing longer as the holidays approach because people are trying to get tested before they meet family and friends. But a lot of public health officials have come out in recent days saying that that's still not a foolproof method, that even if you get tested, you may get a negative test and a few days later you could actually be positive because the test may not show you're positive. And a few days later, when you're sitting around the Thanksgiving table with friends or family who live in a different household, that's when you may have the virus that wouldn't have showed up in the COVID test. So we have that on our front page of KLW right now, is cautioning people against getting tested just for the sake of meeting family and friends because you still might not keep them safe. And we want to know what else is on your mind. In fact, if you still have people listening, which I see, Dr. Matyas brought in a great number of questions. If anyone has issues or topics that they want us at KALW Radio to report on, please note it down. Please put them in the chat box in wherever you're in this live stream, and then I can pass those comments and questions along to my team, or you can type them in to this page that Patrice shared, kalw.org/elections, which will then be rolling into our health coverage. And do you have any questions about what we do or what kind of topics we cover at KALW Radio?
Well, so I am really thrilled that that you were on the call with the doctor, because you're right. So many questions were really teased out. For example, were you on? I know you were in the waiting room kind of early. Where did you hear the conversation around the increased number of cases in the Latinx Hispanic community being 1.5 times more than whites? So he brought that up. I would love to hear more information about that. I bet you our community would as well. A good friend of mine was just tested as COVID positive. She's young. I think she's in her 30s, but she's in the house with a family of her parents, older adults. And she's just so disappointed. She posted and she said, I'm so disappointed. I've been so careful because, not because of myself, but because, exposure to my family could be harmful. Mm-hmm. And so I would love to hear more, those stories, those personal stories from our community of people that are affected, because it makes it real for people that are like, oh, that's over there. Oh, 100 cases. I don't know any of those 100 cases a day. And that's another thing the doctor said. He said they're seeing 100 cases per day now, right now.
Right.
And so, but if it feels impersonal, we don't get it. It goes, not to say it goes over our heads, but it does. So those personal stories, I would love to hear. Also, he talked about the Black community, multiracial community. That is the community that if they have COVID, they are hospitalized. He says they're hospitalized, and he's like, and it's multiple reasons. It's, our social norms, it's our social behaviors, and it's our underlying conditions. Those three things, like poorly controlled. And then he talked about poorly controlled hypertension, poorly controlled diabetes. Like, we need to have real conversations about that, and make it personal. There's many people that are not controlling these diseases. Why? So I feel like that is a conversation that I would like to, journalistic lens that I would like to see.
That's really great. And, one of my interests is actually reporting on high risk disease, and especially diabetes. I've done a lot of stories looking at diabetes in ethnic communities and marginalized communities around California. And, that is, again, people, there is a prevalence of diabetes among African-American neighborhoods and Latinx communities, among Native American, Pacific Islander communities as well. So, I want to make sure that we can let people know who have family members with diabetes, type 1, type 2, hypertension, other high-risk health issues like asthma, what you can do to protect yourself. And I'm really glad you talked about personal stories, because I think that's critical. I've just put in the chat, Patrice, that our media partner, which is El Tecolote newspaper, is a bilingual newspaper in English and Spanish. They're based in the Bay Area as well. And they are launching a podcast series. And one of their early episodes is actually going to document personal stories of people who have already had COVID-19, what it was like to go through this disease, what it was like for their family to take care of them. And I agree wholeheartedly. It's so important to hear personal stories, because otherwise it seems far removed. People wonder, well, it hasn't affected me or my family. Why is it so bad? I could still go out and, not worry about a mask. But when you hear the personal stories of people who were impacted, you then get a sense of why this is so important and how easily it can happen. Because, I've heard stories about, from people who never thought it would happen to them. And then lo and behold, it did. So I'm glad that you brought that up. And El Tecolote which I'm happy to share, and thank you for posting, is also going to be working on that in the Latinx community and documenting people in English and Spanish.
That's wonderful. And I think also Dr. Monique Hunt's question about long-term impact of COVID-19 and that tracking of numbers, but also just I just believe that journalistic approach should be informative so that we know we're informed, but also bringing in those stories just really brings it home. And you just bring it home to Solano County when you feature our story. So
right. And the other thing is, it can get depressing for people to hear about COVID all the time. And like for me and my family, it's been something we've been talking about 24/7, and we've been doing everything we can to protect ourselves because, I have high-risk family members and we're very concerned. But we also want to point to solutions and positive stories about people like health workers who are doing just great work at the front lines, people like Patrice who are out there. You're teaching so many people in the community about how to protect themselves in such a crisis. And, we want to find those in Solano County, people like you and others, doctors, health professionals, even students. Just today, I read that there's a school in Alameda County where the students have developed a drone that they will then launch into the sky, and it will spray disinfectant to clean up their football field and make sure it's sanitized. So, we want to hear about just cool, innovative, creative solutions to solving this problem at a local level. So if anyone has ideas for just great, inspiring stories, send them to me. And I'm going to put my email address in here as well, because
email address for sure.
I'm very eager to hear from everybody in the community about story ideas, about innovation, because people are adapting very quickly to the pandemic, and people are coming up with super smart ideas. So,
I tell you, we absolutely have some really wonderful things happening in our community. You mentioned about food insecurity, and we have community organizations that are stepping up to the table, and they really have these amazing inspirational stories, including Food for Free Solano. Heather, that is there. She was running food stands in communities through these amazing community stand partners. And she's expanded to a huge distribution center out of Solano Fairgrounds. And it inspires me. Faith Food Fridays is another organization that has gone from 2 to 3 days a week and now in doing drive-through food distribution. There is Vallejo Together in Vallejo, and Vallejo Together is one of the many groups that service and Project Blessing Bags and so many others that impact the unsheltered communities.
Right.
Whether in encampments or in motels, and this is happening all throughout the county, where these organizations that are so they're not funded well enough, and they are out there doing the great work. We also have a great organization that we can connect you to that is doing senior work, and the name is Debbie Toth. If you here on the line, you're going to strangle me there. I cannot remember the name of your organization. I think it's Choice in Living. I'm going to figure it out.
Okay.
And so we have all of these organizations and all these inspirational stories that make me really proud to live in Solano County.
That's really great. Yeah, and if you can share the list with me and even connect me to some of the people, we would love to feature them. I mean, in listening to Dr. Matyas speak, I then immediately texted my news director at KLW, said how great that interview was, and we want to bring him on the air too. So, you're just such a connector, Patrice. We want to make sure that we can highlight the voices of people around the Bay Area. A lot of mainstream media outlets forget about covering the smaller counties, and bigger outlets don't often get to Solano County. We want to make sure that we can include yours on our radio broadcast. We're an NPR member station, and we reach all across the Bay Area, and we want to make sure that we can really highlight these diverse voices that can just educate and inform everybody. The other thing is our project focuses on inequity. So as you said, and as the doctor said, COVID-19 is disproportionately affecting communities of color. And that's the thing that we want to break down. Why is that happening? And how can people be lifted out of that? So like vaccines is critical. What are some other grassroots efforts that people in their own communities are doing to spread the message? I want to cover stories of people who live in places like Fairfield that are just letting people know what resources are available, food pantries and food banks, so that we can talk about change happening within the community. Just yesterday, I was on the phone line with the Boys and Girls Club in East Palo Alto, and they have these hubs where students can study because a lot of students don't have a quiet place to sit and do their homework, because there's just a lot of distractions in their home. And many of the students come from Latinx backgrounds, and they just need a quiet space with a tutor available, and the Boys and Girls Club is providing the space where they can get Wi-Fi for free and do their homework. And if there's places like that where students can learn or get access to food, like you mentioned, we want to make sure we can also include those stories. Like the personal stories. Yeah. So this is just a great opportunity to hear from the community. I really am valuing that you're sharing this with your audience, Patrice.
No, you're welcome. And by the way, Rhonda Smith is on chat, and she says she as soon as I pulled it up, she's Johnny on the spot. It's choice and energy. So she does amazing work with our seniors in Solano County, and I also believe in Contra Costa County as well. And by the way, Rhonda Smith is also a huge resource. She runs the Solano Volunteers, and I believe a few weeks ago, she finished this project where her volunteers touched all of a senior database through wellness checks to make sure that they were okay and they were and see if they needed anything, but just doing those touches. And I thought that was an amazing project. She does even more than that. She's also a resource for all nonprofits in Solano County that need volunteers. So she is a powerful resource. She acts all shy about getting on video, so I don't know if you'll be able to get her to do that, but she may come on.
We're a radio station, so you don't have to share your camera, just your audio.
Okay, Rhonda.
So Rhonda, we might be coming to you for an audio interview, and you won't have to worry about being on video. I say I got into radio because I can be camera shy myself, so I completely get it.
Well, and it's crazy because she's stunning, so it's really ridiculous.
Yeah, well, I'm glad that you mentioned that that all these great people to talk to.
Yeah. So Rhonda just gave her commitment. She's going to come on to your show.
We're going to ask you questions about how you're saving the community, Rhonda.
She is. She's doing great work. And so Gail Vaughn says that she wants a copy of that list to share with the Solano Commission for Women and Girls, which has work on teams. They have teams of homelessness, poverty, food insecurity, human trafficking. The Solano Commission of Women and Girls is doing phenomenal work. Gail, I believe there is a new a director of the Solano Commission of Women and Girls. Laura Petty, I think it's Laura Petty. And that woman, she's an attorney in Solano County, and she is a powerhouse. So not only are they doing great work, but I was really happy to see that she was a leader. Anyway, I'm going on and on. I can talk to you forever, Sonia. We were supposed to have a 10-minute segment, and ma'am, we've been going on and on.
I know, we could just meet for coffee when the pandemic is all over and chat it up. It was really great to hear. Thank you to everybody that commented, and I would love to talk to the Solano Commission for Women and Girls too, because, one of the things we're looking at as well is about the burden on a lot of women in communities who have to take care of their children who aren't able to, as their kids aren't in school. And just this week, there was a front page article in the New York Times about how it's really shifting the burden on a lot of moms. And, and some dads as well. There was a story on NPR about dads that are taking on a lot, but, it's really affected women. So I would love to talk to the Solano Commission for Women and Girls. And Patrice, thank you so much for having me on, for allowing me to introduce KLW Radio. You can tune in at 91.7 FM on your radio dial to listen to KALW every day, and check out our programming online at kalw.org. And we look forward to hearing your questions and comments. So email me or fill out that form anytime.
Awesome. So thank you for being with us, Sonia. I'm going to say goodbye to our guests, and then I'll say goodbye to the audience. But thank you so much. It is you were kind of the cherry on top.
Thank you. Well, this was a highlight of my week, and I hope you have a wonderful Thanksgiving coming up. I see that the Commission for Women and Girls, Solano Commission, is meeting tonight on Zoom. So thank you for that, Gail. And we'll talk soon, and we look forward to staying in touch.
Thank you, Sonia.
Thank you again, and have a great weekend.
You too. Well, oh my goodness, was that a great show or not? We've had two amazing guests, and this was quite thrilling. Stay tuned for next week's edition of the K. Patrice Williams Show. We are planning a great event for next week. We are calling it the Women's Business Entrepreneurship Forum. We're going to be featuring Brenda Knight. We're going to be featuring a woman that is coming on, Melinda Lee. Melinda Lee can help us refine our pitches in just a matter of minutes. And also we're going to have on our show someone from NorCal PTAC that is going to be able to talk to us about certifications and giving government contracts. We felt like we would just do one big show next week, and that show would help women entrepreneurs really advance their business. Why are we focusing on women entrepreneurs is because today is Women Entrepreneurship Day. We didn't find out until yesterday, so we couldn't do it today, but we're going to have that for you on Monday, and we're going to be very excited to present it. So, and we're going to be, Lisa Clinton says, we're celebrating women entrepreneurs. Yes. So we'll see you next week. We'll be announcing the exact day and time, but I believe it's Monday, and I think we're going to do 10 a.m. So anyway, thank you all, and thank you all for sharing in the chat room, and take care. Have a great weekend.